So a very warm welcome to all of you to today's information session about the FWO fellowships for senior clinical investigators. My name is Christine and I'm a science policy advisor at FWO. Also joining me here today is my colleague Helen Boterberg, who is the account administrator for the medical sciences at FWO. And both of us will be happy to answer your questions at the end of this webinar during the live Q&A session. If any questions pop up already during the presentation, please feel free to post them in the chat box and we will get back to them during the Q&A session at the end. But first, to start, I will go over the main modalities of the program for senior clinical investigators. So to translate basic scientific knowledge into applications that directly benefit patients or general healthcare, it appears that clinical scientists are ideally placed. From their clinical experience, they know what the system needs and specifically also what the patient needs. And because of their scientific training, they are in an ideal position to advance practice-oriented research. And indeed, in a recent study by Ankars and colleagues, it was shown that clinical scientists are more likely to perform use-inspired research that builds on prior insights from applied literature. And moreover, their studies are more likely to trigger applied follow-up research. Unfortunately, however, although clinical scientists could be an important motor driving translational biomedical research, in practice, they often are not at liberty to engage in such endeavors because they are fully occupied in the clinic. And this is where we at FWO provide a solution by freeing funds to release clinical scientists from their clinical duties, giving them time to perform such translational research. And the same study by Ankars and colleagues has also demonstrated that our fellows have an increased publication rate when compared to their peers, and importantly also that their research focus shifts more towards a translational perspective, which can have important consequences for patients and for the healthcare system in general. An important remark to be made here is that the Senior Clinical Investigator Fellowship is part-time only, ensuring that the fellow will remain strongly embedded in the clinic at the same time. So the fellowship is quite unique in this respect. It will not be paid out to the fellows themselves, rather to the hospital to finance their clinical replacement. And usually the grant is meant for 50% replacement. But in exceptional cases, when a fellow really cannot be spared from the clinic for the full 50%, there is also an alternative option available where the fellow will be replaced for 20% in the clinic, and the remaining funds can then be used to finance scientific or technical support staff. Typically, this would be, for instance, a PhD student or a lab technician, but other options are also possible. This 20% option should be the exception rather than the rule, and it also needs to be thoroughly motivated in the application. An example of this would be, for instance, a surgeon who performs very complicated procedures that cannot be taken over by a replacement, and in this case, this should also be attested in writing by the head of the clinic. So, in order to be eligible to apply, you should be recognized to practice your profession in Belgium as a medical specialist or a general practitioner, or alternatively as a pharmacist specialized in clinical biology. You should be working at a university hospital affiliated to a Flemish university with a contract of indefinite duration. For general practitioners, of course, this does not apply. However, we do ask that a GP is affiliated to a Flemish university in the Department of Family Medicine for the duration of the fellowship. You should spend at least 80% of your time on purely clinical activities, meaning that you're not already working as a researcher, for instance. You should hold a PhD degree with no more than 20 years of seniority. And similar to all other FWO fellowships, we only allow 2 attempts to apply. But importantly, because this program underwent major revisions a few years ago, Since then, the counter was reset to 0, so you can apply twice again, irrespective of potential earlier attempts from the year 2020 onwards. So the overall aim of the fellowship is to provide a platform to our fellows to establish themselves as independent researchers. The fellowship has a duration of 5 years and it is renewable 2 times, meaning that in the best case, the fellow will have funding for a period of 15 years in total, which should give them ample time to build their own research line with long-time perspectives. So since the revision of the program, the budget has increased. So now there will be 60,000 euros per year available for the financing of the clinical replacement. And for general practitioners, the calculation of the annual fee will be based on the wage of a part-time lecturer at the university, taking into account seniority. In case the fellow has chosen the 20% replacement option, the remaining amount can be used to finance the supporting staff. And also here, the maximum amount per year will be 60,000 euros. What is also new since the revision is that now our first-time fellows will receive a bench fee to help them start up their research. And this bench fee will amount to a maximum of 100,000 euros for the 5 years or 20,000 euros per year. And here the same rules and regulations apply as for our other pre- and postdoctoral fellows. So what do you need if you want to apply for this fellowship? First of all, you will need the formal commitment of both the director of the hospital and the dean of the faculty that they will provide actual clinical replacement for you. And here it is also highly recommended to have the name of the person or the people who will be replacing you written down in the application. And second, they should also guarantee that you will be reinstated upon completion of the fellowship. You should submit your application in English via the e-portal on the FWO website. And then an international jury will evaluate your application. This is also new since the revision of the program, so we now have a fully international jury. There are no Belgian members anymore to assure a fair evaluation process. The jury will take into account the following aspects. So first of all, of course, the expertise of the candidate for the first-time applications or for the renewals and evaluation of the previous period. And then secondly, the jury will look at the quality and the added value of the proposed research. And then finally, for the final renewal, we would also like to see that the established research lines have a long-term perspective. So meaning that the hospital has plans to continue this also after the completion of the fellowship, and preferably, of course, that the fellow will remain in the driving seat to continue this. So I would also like to spend a few minutes on the renewals, because this procedure has changed quite drastically since the revision, and this seems to have stirred quite some reaction. So as opposed to earlier, when a renewal was almost certain, since the revision, there are more stringent quality requirements attached to the process. So together with their application for a renewal, fellows will also have to submit a progress report of their past activities, and this will be evaluated by the jury. So the jury will assess, among others, the scientific output so far, the growth of the candidate as an independent researcher, the impact of their results on clinical practice, so in other words, the translational nature of their research, and finally, the international recognition and collaboration of the candidate. Importantly, in line with FWO regulations for other fellowships, there can be no second attempt if the renewal is rejected. So here you see a graphical representation of the success rate since the revision. So each year we have funds to grant 8 new fellowships, which, based on the number of applications last round, translated into a success rate of approximately 1 in 2. So out of those 8 successful first fellowships, we will renew 6, and out of those 6, 4 can then be renewed for a third and final period. So overall, I think you can appreciate that in comparison to other programs at FWO, The success rate for the clinical fellowships is quite high. This is done intentionally because we realize and we know from surveys that it is not straightforward for a full-time clinician to find the time to apply. And by having a relatively high success rate, we hope to keep the fellowship accessible and make it worthwhile to apply. So besides this high success rate, in order for your application to have an even higher chance of making the cut, we highly recommend you to check the score grids that the jury members will use to evaluate your proposal. So these score grids contain all of the evaluation criteria and can be found on the Senior Clinical Investigator webpage. I would suggest that you try to assess your application using the score grid, and if possible, that you also ask one of your peers to do the same to make sure that you check all of those boxes. We also advise you to mention any aspects of how the COVID pandemic has influenced or will still influence your career in the relevant boxes in your application, and we will ask the jury to take this specifically into account when assessing your candidacy. Then some important dates to mark down. So the call is open since last week, and we expect the final submission by the 1st of March, no later than 5 p.m. via the e-portal. The results will be announced by the end of June, and we strive to provide you feedback on the application shortly thereafter. Feedback will be provided to all applicants regardless of the result, and the fellowship will then start on the 1st of October. Successful candidates will work under the regulations for Senior Clinical Investigator, which you can find on our website. And once you're active as a fellow, if you have not done so already, we will expect a signed declaration specifying the details of your clinical replacement. You will also have to provide 2 reports of your scientific activities, one halfway and one at the end of the term, which then will also be used to evaluate your renewal when applicable. And all of those activity reports will be assessed by the jury clinical fellowships. And to conclude, here are a few additional tips and tricks on how to submit a winning application. So as I've already explained, since the revision, the emphasis of the call is on translational research, because this is where a clinical scientist can really make the difference. So please make sure that your topic of choice is both innovative, but also specifically translational. And as indicated before, make sure to check your application with the score grid to make sure that you include all of the relevant evaluation criteria. And then, as the purpose of this fellowship is that the clinical researcher can build a research portfolio that has strong future perspective, it is important that the hospital will engage itself to continue what the fellow started. So please make sure that this commitment is also attested in the proposal. Make sure that you obtain all of the required signatures from the hospital director, the dean, and your clinical supervisor, and the required attestations, for instance, the certificate issued by the government that you are recognized to practice in Belgium. If possible, also provide the details of your clinical replacement in full, because this will give you bonus points, as you will see in the score grid. And finally, make sure that you have prepared or updated your Personalia page on the FWO e-portal. So you can find additional info and details on our webpage. Please also don't hesitate to contact us via email using the address met@fwo.be if you have any remaining questions or concerns. And with that, I think I covered most of the general modalities of the program. So now we can move up to the next part of the webinar, which is the Q&A session. So please feel free to ask any questions via the chat box or raise your hand, and then we can unmute your microphone. Thanks for your attention.